Hello, this is Samna, optometrist in Global College of Allied Health. Today I am going to discuss about the topic on nystagmus, part 1. The definition of nystagmus, it is defined as regular and rhythmic through and fro involuntary oscillatory movements of the eyes. The classifications are pendular and jerk nystagmus, rapid and slow nystagmus, fine coarse nystagmus, latent or manifest nystagmus. The features of pendular or jerk nystagmus, that is, in pendular nystagmus, the movements are of equal velocity in each direction. It may be horizontal, vertical or rotatory. In the jerk nystagmus, the movements have the slow component in one direction and the fast component in the other directions. The directions of the nystagmus is defined by the direction of the fast components. It may be right, left, up, down or rotatory. The features are rapid or slow nystagmus. It can be a rapid movement or slow movement. The fine or coarse nystagmus. The movements may be fine or coarse. In latent or manifest nystagmus, the nystagmatic movements may be latent or manifest. Causes: these occurs due to the disturbance in the sensory visual pathway, the vestibular apparatus, semicircular canals, midbrain disturbance and cerebral disturbance. The type of the nystagmus, it is broadly classified as physiological nystagmus, congenital nystagmus and acquired nystagmus. The physiological nystagmus is further classified as optokinetic nystagmus, engaged nystagmus, physiological vestibular nystagmus. The optokinetic nystagmus, it is a physiological jerk nystagmus which is induced by presenting to gaze objects serially in one direction and such as stripes of a spinning optokinetic drum. EGN, it is a fine jerk horizontal nystagmus which is seen in normal persons on the extreme right or left gaze. VOR, which is a jerk nystagmus. It can be elicited by stimulating the tympanic membranes with the hot or cold water. This is the basic of the calorie test. Cause, which means cold in opposite directions, and warm water, pouring the warm water, which causes nystagmus in the same directions, same ear. The congenital nystagmus, these are classified as afferent or sensory nystagmus, idiopathic infantile nystagmus, latent manifest nystagmus, spasm mutans nystagmus, blockage syndrome. Afferent or sensory nystagmus, it is also known as congenital ocular nystagmus and is usually associated with a sensory deprivation due to the ocular albinism, Leber's congenital amaurosis, bilateral congenital cataract, aniridia, bilateral optic nerve hypoplasia, etc. Idiopathic infantile nystagmus, it is also known as idiopathic congenital nystagmus. It is characterized by horizontal. It is a hereditary condition. The onset is very early, usually by the 2 months of age, away from conjugate horizontal nystagmus. It worsens with a fixation but improves within the null zone and on convergence. The null zone, which is the direction of the gaze in which nystagmus reduces. Occasionally, the nystagmus can be a vertical or rotatory. Latent or manifest latent nystagmus, it is not present when both eyes are open. It is present only one eye is closed. It is a jerk nystagmus with a rapid phase towards the uncovered eye. These patients are tested for visual acuity by fogging the other eye rather than occluding. It is associated with a congenital esotropia and DVD. The spasm nutans, it is a fine pendular horizontal nystagmus associated with a head nodding and abnormal head posture. Its onset is infancy and self-resolves by the age of 3 years. The next one is nystagmus blockage syndrome. The nystagmus is congenital, manifest and horizontal and remains in the same whether the both eyes are open or the one eye is covered. It increases in intensity as the eye is abducted and it is blocked when the eye is adducted. The esotropia is non-accommodative and variable. It has an inverse relationship between the nystagmus. When the esotropia increases, the intensity of the nystagmus decreases and the vision improves. The acute nystagmus is characterized by oscillopsia. Is often associated with either neurological abnormalities. These are the neurological abnormalities such as gaze-evoked nystagmus, periodic alternating nystagmus, peripheral vestibular nystagmus, central vestibular nystagmus, acute pendular nystagmus, seesaw nystagmus, convergence retraction syndrome, dissociated or conjugate nystagmus. Thank you.